I have a question. If there's something that people want to do until they're able to get out of the house finally, come in, reward themselves with one of these perks or facials or lasers, is there something we could do at home? Or is there a product that you guys have in office or something what can we do at home to help maintain or give me a little perk, a little pick me up or whatever, you know?
I've brought a whole bunch of things with me today. So the first thing that we should talk about is sunscreen. Because
Okay.
although sunscreen, you're not going to see the immediate gratification from it, it is the best thing that we can do for ourselves, especially when you're younger. They say that the sun damage that you have at our age was mostly from the sun that you received before you were 18, 20, 25 years old. And I think now we're all really good about making sure that our children and our grandchildren have sunscreen so that they're never going to have the problems that we do with skin cancers and pigmentation and texture and crepiness of the skin. But it's never too late to start using sunscreen because at least you won't compound the problems. So sunscreen is very important. And people ask, what are the differences? So number one, what's the difference between sunscreen and sunblock? Sunscreen uses chemicals to filter out the sun rays. Sunblock actually blocks the sun from touching your skin. And the most common ingredients found in the sunblocks are zinc and titanium. And if you're somebody that's concerned about putting chemicals on your skin, then a sunblock with zinc or titanium would be an excellent choice. Otherwise, you have all the sunscreens. Now, the sunscreens protect against, some only protect against the UVB burning rays, others protect against both the UVA and the UVB rays. So sunblock, the zinc and titanium protects you against both. So it's an excellent choice overall. And sunblocks are getting made better and better. It used to be that you would see a whiteness to the skin, but now they're making them so they're micronized and leave no color on the skin. The sunscreens, a lot of people, this is something that I'd really like to hit on. A lot of people's makeup or moisturizer, they'll say, well, it has SPF in it. SPF is important, but it's only one component of a sunscreen. SPF refers to the UVB burning rays. Now, on a day like today, where it was pouring rain all day, you're not going to burn. However, there are still the UVA tanning rays that are present, and those rays go through glass. You can't burn through glass, but you can get the tanning rays through glass, and those rays are present all year long. So you're not going to burn on a day today, but you're going to get those tanning rays. We used to think that the tanning rays were the safer ones, but now we know that those rays penetrate deeper into the skin, and those UVA rays are what are responsible for the wrinkles and the brown marks, the things that make us look older, and also contribute to skin cancers. While the UVB burning rays, the ones that don't go through glass and are primarily during the summer and spring portions of the year, those are the rays that cause sunburns and definitely cause skin cancer. So for somebody who's concerned about cosmetics and for preventing skin cancers, then you want to use something that's broad spectrum, meaning it has both UVA and UVB rays. And you need to reapply regularly. First of all, it takes sunscreen or sunblock about 20 minutes to start to work. So you should really apply it 30 minutes before you go outside. And then it really only lasts 2 to 4 hours. So if you have something that is in your makeup or moisturizer, you're putting it on at 7 or 8 a.m., well, it's not effective when you go out for your lunchtime stroll around your neighborhood. So definitely reapply.
That's actually an excellent distinction. I thought, okay, SPF in my cream that I put on the moisturizer and I'm good, because that's what kind of we're sold to believe. You know, you made a very, very valid and super important and critical distinction between your SPF and then also reapplying something with a UVB or UVA. And I like to put something a little more natural. So it's great to have a zinc and to have another option.
What should we talk about next? Pigmentation, texture?
What in terms of now that we're home, what is something that's easy to work on?
Okay.
Kind of do something with.
if you're looking at something that you could do at home, then chemical peels, that needs to be done in the office. I did bring an example of a few other products, though, that can be done at home. And I would say the biggest ones for giving some improvement, even within a few weeks, although it may take a good 2 or 3 months to see a significant improvement, perhaps even 6 months. And that would be products that have the different fruit acids in them and retinols.
Oh, wow.
So we like to do a combination, again, depending on what your needs are and your skin types. But for a lot of people, fruit acids are very helpful. They can be used in pads.
It's easy. I love to use pads.
Let's say, we have some pads that have salicylic and glycolic acid, or you can use it in the form of a wash. And glycolic pads, salicylic pads, lactate pads, and cleansers, they help to get off the top dead layers. So the skin looks a little brighter, a little smoother. It may help a drop with pigmentation, but by getting off those top dead layers, then the other retinols, and if you need bleaching pads, it helps them to work better. So for retinols, for example, in our office, we have 2 different versions of retinol, a milder one for people with more sensitive skin, and then for people who have worked up to it, a little stronger version. Retinols help with fine lines, irregularities in color and texture, smoothing out the skin so you get a better glow, makeup goes on easier. And if you use the combination, those fruit acids get off the top dead layers so that retinol can penetrate better.
That sounds great.
Well, yes.
And you do this while we're home now.
Exactly. And while those products, they really help with texture and fine lines, and while they may help a little bit with pigmentation, a lot of people are concerned about the brown, the sun they've had over the years, and want to do a little extra for pigmentation. So there's many different brightening pads and actual hydroquinone to help with bleaching the skin. So for example, we sell some bleaching pads that are brightening agents, and we can add to them different amounts of hydroquinone. So we can make a product up to 2% hydroquinone, or we can even go up to the 4%, which is the prescription strength that you can buy. But it's always really important to have a board certified dermatologist evaluate your skin, because you never want to treat something that is a medical condition. A lot of times you can tell, oh, it's just a little, some freckling, a little like brown from the skin, but God forbid you have like one pigmented area and you go somewhere and they try to sell you products or try to sell you laser treatments, and God forbid it was a melanoma. So it's important to really have your skin evaluated by somebody who's knowledgeable and make sure you have the right treatment.
Are you doing televisits now, like with everything on? Oh, wonderful. So how, like, what would be the protocol? Let's say, you know, somebody joined us today. They love what we're talking about. They really want to be proactive with their skin until they can get out there and they can do one of the wonderful treatments we're talking about. But they want to see what their options are. They feel a need. Like your skin has a thirst sometimes. You know, it's not just the mind. The mind and skin are talking, and they want to do something. So could they contact the office, your office, to schedule a televisit with you if they wanted to start something?
Yes, we are conducting telemedicine visits. You know, we have a lot of people who are senior citizens and not able to come in, or people concerned about exposure. So we're really just open now for emergencies. So we're seeing a lot of patients with infections, burns, lacerations. But yes, we are happy to do telemedicine visits to discuss really anything besides the looking good part. You know, a lot of people have more chronic skin conditions. So we're happy to help with acne, eczema, rosacea, any types of rashes.
So I have a very good friend of mine who I was talking, and I was really excited. I was going to get together with you and we were going to talk about. And I saw her without her makeup, and she has gorgeous skin, and she has suffered from rosacea, and she has a hard time dealing with it. But I said there has to be options. So that's a big question. A lot of people have rosacea. I think it's more
Yes.
common than uncommon, right?
Yes. Rosacea is a redness of the skin, some broken capillaries. And many times when you're younger in your teenage years, you might just think of yourself as a flusher, a blusher, your skin turns red easily. But then as you get older in your 20s and 30s, you start to notice a few of the broken capillaries, especially in this central portion of the face. Maybe that redness isn't going away as much. And as the years go by, it progressively worsens. More redness, more broken capillaries, more flushing and blushing. And some people start to get pimples with rosacea. And some people, decades down the line, can get a thickening of the nose, which can become permanent. And we never want you to get there. So rosacea is a medical condition. It runs in some families, especially those of Northern European descent and with light hair and light eyes, but it can happen in anyone. And now it's actually a good time to start with these treatments. You're home, and they all take a while to work. A lot of the rosacea and acne medicines may take 2 or 3 months to start to work, 4 months to see a good improvement. So now's as good a time as any to start.
So they could reach out by all means.
Absolutely.
This is a great time. Okay, so here's my other, like, kind of, as we're getting closer to like the end of our session, I want to start. I really want to be proactive. I want to do something great for my skin. I want to reward myself that I'm listening. I'm staying home. I'm trying to eat healthy. I'm really trying to do the best that I can. Like the products you showed, like the pads, after someone's had like a televisit with you, is that something that you can like put something together, something that could be mailed out at home or curbside pickup? What are the options?
We frequently do that for people because sometimes there is a product that they really like, but they may not be able to come in. We understand everybody's schedules are very busy. We also have a few other lines. We have our cosmetic surgeon in a jar. This is probably one of my favorite cleansers ever. It is a very mild, gentle cleanser, but your skin feels so clean. And dermatologists in general are not big fans of anything that really scrubs because we don't want anyone to get inflamed or irritated. This just has a tiny bit, just a couple of little scrubbies in there, but I've never felt my face feel so clean after using this cleanser.
No, that's funny you said that. I'm dying to try that because I like a little scrub in my cleanser. I do.
Yeah.
That's funny.
And we have a couple of other product lines also that we can help tailor depending on your skin type. We also have, this is probably our best seller for a sunscreen. It's a broad spectrum with a really nice feel to it. You get your makeup right on over it. It doesn't leave any kind of uncomfortable feeling, and it's a broad spectrum and sunblock, not sunscreen.
Okay, good.
Yeah, a few other things also, extra special hydrators and antioxidants. That's one thing we haven't mentioned yet. Antioxidants are products with, say, vitamin C and vitamin E that can actually work using the oxidative effects on the skin to reverse some of the signs of damage, as can the retinols. So we have a whole host of products, and then we have some more that work in a medical way. Say if you have toenail fungus, like maybe somebody has toenail or fingernail fungus and they want to start treating that, because here we have a few months before we're going to be able to get out in our sandals and our flip-flops. So this might be the right time for someone to start treating that. And acne coming up. Hopefully these kids are going to be able to go to their proms and all. But now's the time to start treating. So that way when you want to get into tank tops and spaghetti straps and bathing suits, they'll have the few months for the medications to start to work.
I mean, just to kind of, it's amazing that in one session, we covered so many amazing points, tips, and like little, almost like secrets that are so easy that you gave us now, that we're able to kind of be in touch, get in touch with you and do something while we're home. And it's wonderful. Also very important is the sunscreen aspect. Everyone's thinking, oh, because I'm heading out, but I'm not going to the beach or whatever. You still have to make sure you're being diligent and good about your sunblock, which is so key. You made that distinction with the SPF, which I thought today is one of the key things that you discussed with us.
Yes.
But I'm happy you touched on something, which I'm looking forward to our next session when we get together, is there's a lot of us that have teenagers at home, and they're
Mm-hmm.
the stress, they're having little mini breakouts, and we're like, oh my God, I don't know what can I do? You have the washes, you have whatever. So I'm sure, and I don't want to give out our secrets yet, but next time we get together, I want to cover all that. It's like
a great idea.
a teen skin SOS. And I think we really need to listen and give them some really important information.
Wonderful. We can talk all about what causes acne, how to prevent it, how to make your skin look the best it can be, and make ourselves feel better.
We're all TikToking and snapping away, so they want to look just as good as everybody else because we're all on the Zoom call. So thank you so much, Dr. E, for like all the
Thank
information.
you.
I'm looking forward to our televisit so I can see what I can custom tailor for my skin. I'm going to put myself out there. Everyone can see my results and give me feedback. So thank you
Wonderful.
so much for today. Thank you for joining us.
Thank you, everyone.
Our next session. Enjoy the rest of the day. Thank you.
Thank you. You too.